Viktor Frankl spent his career as a psychiatrist, and he spent much of that career in productive disagreement with psychiatry. His central objection was not to the tools of the profession, medication, diagnosis, clinical technique. It was to the foundational assumption about what the tools are for. Mainstream psychiatry, then and now, understands its primary goal as symptom reduction. If the patient is depressed, reduce the depression. If the patient is anxious, reduce the anxiety. If the patient is suffering, reduce the suffering. This is, on its face, humane and reasonable. Frankl's challenge was more radical. What if symptom reduction is not the same as healing? What if a person can be technically symptom-free and still fundamentally unwell? What if the goal of therapy should be not the absence of distress but the presence of something, a capacity, an orientation, a way of meeting life, that makes the inevitable distresses of existence bearable? He proposed that genuine psychological health should be defined as the capacity to respond to the demands of one's actual life with meaning. Not with happiness, meaning. Not with the absence of suffering, meaning. A person who can face what their life actually presents, find in it something worth doing, something worth loving, something worth suffering for, and bring their full human resources to that encounter. This person is psychologically healthy in a way that a symptom checklist cannot capture. This definition has clinical implications that are both more demanding and more respectful than symptom-focused psychiatry. More demanding because it requires attending to the full human being, not just the biological substrate and not just the behavioral patterns, but the neutic dimension, the person's relationship to meaning and value. More respectful because it treats the patient as someone who has a specific, irreplaceable life to live, rather than a generic organism whose deviant states need to be normalized. Frankl described the therapist's function as bearing witness to the neutic dimension of the patient, holding open the possibility that the patient is more than their pathology. This is not a poetic description. It is a clinical one. The patient who has collapsed into their depression, who identifies completely with their illness, who believes that what they experience is all they are, this patient has lost access to the dimension of themselves where meaning is possible. The therapist who can perceive and reflect that dimension, even when the patient cannot, provides something that medication cannot, recognition. He was direct about the limits of pharmacological treatment. Medication can alter the biological substrates of experience. It can lift the floor of depression, quiet the alarm of anxiety, stabilize the oscillations of mood. Frankl did not oppose this. He was a physician, and he used pharmacological tools when they were appropriate. What he opposed was the assumption that altering the substrate is the same as treating the person. The biological dimension of the human being is real and clinically important. It is not the whole of what is there. There is also the question of pain. Modern medicine and modern psychotherapy share a cultural assumption that pain is fundamentally bad, to be eliminated whenever possible. Frankl's framework challenges this without romanticizing suffering. Pain that has no meaning is simply destructive. Pain that is met with meaning, the grief that honors a genuine love, the difficulty of meaningful work, the suffering that forces a person to confront what they most value, is not bad. It is part of a full human life, and attempting to eliminate it entirely would eliminate something valuable along with it. The goal of therapy, in Frankl's account, is not to produce a person who no longer suffers. It is to restore a person's capacity to suffer well, to meet difficulty with the full resources of their humanity, including the freedom to choose how they relate to what cannot be changed. This is a more demanding vision of therapy. It is also a more human one. Subscribe to the Psychology of Viktor Frankl to explore more of his timeless ideas.